2, 1. All right. Well, good morning, good afternoon, and good evening to everybody who's listening in, either here in Australia, in New Zealand, or in the States, wherever we are broadcasting up to. Welcome to the Straight Talk Mind and Muscle podcast. I've got a very exciting guest for myself here, and I'm sure everybody's going to be very interested in hearing what he's got to say. A true mentor of mine in many different aspects, but really the smartest guy I know for fixing human bodies and getting human bodies back to what they are supposed to be able to do. I'd like to introduce to everybody my good friend, Rowan Ellis.
Thank you, Damien, and thank you very much for your generous, kind words. It's a pleasure to be here. It's a beautiful, warm autumn day in Dunedin, about 20 degrees, so we're making the most of it.
I thought you had tongue-in-cheek there for warm at 10 degrees, but you threw out 20, so I'm impressed.
No, it's a beautiful day.
Oh, awesome. Look, I'm going to give a bit of background on Rowan, and apologies to the listeners and the viewers. I call him Jock because I've known him for so long. Rowan, I just added up, I did my maths, and it's 29 years, my friend.
It is a long time.
Yeah, so look, we've seen each other develop and learn, and it's been an amazing journey. Rowan, I met a long time ago, showing my age, and I went to Rowan to fix my body when I was doing my bodybuilding career, and he was phenomenal and turned out to be much more than just that. I watched him progress over the years to owning an amazing facility, I'd like to call it. Some people might think it's called a gym, but amazing facility called Body Synergy. And all the research that I saw with that was just phenomenal on making the bodies work correctly and undoing a lot of the, the dogma behind exercise and musculo-skeletal exercise as well. So, look, I won't butcher your background too much, Jock, because I probably would. Can I get you to tell me your story, how you got into working with human movement, working with human injuries, and where you sort of progressed on from there too?
Yeah, certainly, Damien. I started 30 years ago as a remedial massage therapist. It was always a very deep passion of mine to help people. I had very little training. I was taught by an engineer from the Honda racing team from Great Britain who moved to New Zealand. Remedial massage was a hobby of his, and I managed to talk him into teaching me. So he did teach me, and it was became an instant passion. It was a burning desire to really get good at remedial massage. I got into it, hit it as I could, was treating as many people as I could, and I did it part-time for approximately 5 years, and then managed to talk my parents into letting me have a clinic built out the back of their house. So, and it really took off. There was no one else really in Dunedin doing remedial massage at the time, so I had the whole market to myself, and I was involved with a lot of athletes very early on who really helped me developing and trialling specific massage techniques for increased range of movement and mobility. I've always had a very scientific approach to treatment. I'm not happy with just how things work. I want to know why it works. So it didn't take long, and a lot of people were coming to see me with long-term chronic pain. I got a bit of a reputation as being the person to go and see. And look, I was fortunate to have that happen, but at the same time, I was limited in my medical training. I had to do all my own study for physiology, anatomy. There was no massage training available in New Zealand at that time. So anyway, I got a reputation as the person to come and see, but I would ask the question always, like, why is this person coming to see me for advice and treatment when they've been through physio, chiropractic, osteopathy? What's being missed? I've always asked that question. So I really started to incorporate corrective exercise, learning as much as I could that was available at the time, and beginning to incorporate trying to assess how people moved, muscle atrophy, muscle weakness, glute amnesia, things like that, and started incorporating exercise rehabilitation into or to complement hands-on treatment. Did that for approximately 3 to 4 years, combining the two. Results were better, but I was still, there was things being missed. So I took some ideas to a EMG specialist, a clinical neurophysiologist who uses EMG, Dr. Peter Taylor, and asked him, look, I've got some ideas around measuring muscle imbalances, muscle awareness. Can we use EMG to test that? So in a long story short, I did 12 years of testing with Peter Taylor, testing patients with long-term chronic pain, assessing their muscles. EMGs at that time were extremely expensive. You were talking $100,000. So I did as much with Dr. Taylor as I could, which really opened our eyes. I made some modifications to gym equipment for training hip extensors and trying to measurably change an individual's muscle pattern and walking gait, etc., and measuring their influence on their musculo-skeletal pain. We set up a small research centre for 2 years and put about 500 people through with chronic pain with positive results before 15 years ago opening the clinic, Body Synergy. Because of the expense of EMG and also the limitations at the time, EMG could only measure 2 to 4 muscles. It wasn't wireless. So it was difficult and time consuming to get measurable data. And also because of only being able to measure 2 or 4 muscles, you tend to focus on, just small areas. You weren't looking at the entire body. You would tend to focus on glutes and hip flexors or, quads, hamstrings, lower back, abs. You're very limited in your approach. So I formed a relationship with a Dunedin company called Silicon Coach that we're using world-class video analysis software. And in our new clinic, Body Synergy, I had a treadmill set up and I would put markers on people's bodies at various positions and look at their postures, standing, walking, and running, where I could perform reasonably consistent pre versus post analysis to look for positive changes in posture and then relate that to exercise. I just looked the other day. Sorry, Damien.
Let's just hold up for a small second there, and we'll go back to Silicon Coach and the treadmill and that gait analysis, because I know that's a key tangent of where you went off to. But let's go back to where you were talking about, because
sure.
Well, you've really thrown a lot out there, and we're talking about started with very simple remedial massage. I'm sure everybody's listening has got some questions. So I've thrown some down here.
Sure.
You're doing remedial massage, and I know your results that you've got with your athletes, with your non-athletes, and you talked about long-term chronic pain. So let's talk about some of those results you got. I mean, I remember going into your, I think it was your 3rd clinic, and seeing the walls surrounded with testimonials from some phenomenal athletes there. What was going on with that? Why were they coming to see a guy in Dunedin, which, by the way, the people that are not listening, that are listening here that are not from New Zealand, the next country is Antarctica.
I am very good at hands-on treatment. I'm very good at soft tissue work. I'm very good at mobilizing the musculo-skeletal structure. And look, I was really doing something that had been lost. It's from my personal understanding, and this may not be everywhere. Physiotherapy, for example, has really moved quite a wee way away from the good old hands-on techniques of old. You're talking 40 years ago. There used to be a lot more manual therapists around. And really, I was doing a bit of a lost art, so to speak. I was very passionate at hands-on. I was reasonably athletic. I could treat people from 7 a.m. in the morning to 11 at night. I used to do that 5 days a week, do 8 hours on a Saturday and another 4 Sunday. I was extremely passionate and prepared to work incredibly hard. And no doubt at times I over-massaged people in my learning experience, but I was very good at it, and just good at just freeing up, mobilizing soft tissues, getting people going again. And what led me on to looking at the whys, gosh, I also made some people worse. I never knew at the time that the only thing keeping people mobile and pain-free was adhesed muscle tissue and stiff joints. I didn't know that as muscles atrophy, the musculo-skeletal structure is going to seize up. I didn't know that happened. So, there was some times where I was so passionate and someone could hardly bend over and reach down, flex forward to touch their knees. You're going to be able to touch your toes by I'm finished with you. And at times that was not the right thing to do.
So you're saying the body lays down that adhesive tissue, that scar tissue, or what a lot of people think of as knots and tightness.
Absolutely. Yeah, so in my understanding of so far in my career of 30 years, I really feel that muscles will adhese and glue up, in a sense get strained, muscle tissue is damaged, fibrin forms to heal that damaged muscle fibers over years and years, it adheses up, causes restriction of mobility. But that restriction of mobility, I believe, is a biomechanical protective mechanism. If someone hasn't had a smack impact injury and they've just stiffened up over time, you've got to ask, well, why is that happening? All right, because if they don't have good muscular awareness and appropriate muscle strength, and you go and increase their mobility, you're just shifting the load as a practitioner. So where's it going to go?
Exactly.
Right. So if they don't have good postural awareness or muscular awareness and know how to hold themselves stable and strong, if you go and dramatically increase their range of movement and mobility, where's the load going? What's going to happen? And often at times I've seen people get dramatically worse because you've taken away their last defensive protection, which was stiffness. They were stiff and limited in movement for a reason. So I always, now of course, 30 years on, always have the technology to service EMG to be able to measure that and show people appropriately and run a system where if people aren't strong enough and they have restriction, I'm not going to touch you until you've done 8 to 12 weeks of rehab, and then I'll free you up and achieve in one treatment, which would have taken 6.
That's awesome that you're starting to answer the question that I've formed a wee while back. And we're going to go on to what surface EMG is and definitely delve into that. So my question would be, can hands-on treatment alone, or what I did in the clinics, can corrective exercise alone get someone back to full function?
Depends on each case. Each case is individual. So if someone's naturally hypermobile, excessively flexible, as a practitioner, we can only free people up. In that situation, you don't want to touch them. Yes, you can palpate, and it's very easy to always find, a facet joint that's a bit stiff, or, palpate sacroiliac joints, which hardly move, but, someone who's got very sensitive hands may be able to feel a slight variation and go, oh, the stiffness here compared from one side to the other. Look, if someone's hypermobile, they're going to respond incredibly to corrective exercise alone, tightening up, and they may not even need any hands-on treatment. Whereas someone whose musculoskeletal structure has seized up will need the combination of corrective exercise and hands-on. But my recommendation is get the hands-on when you're functional and strong.
So now you've really identified, you're saying it now 30 years on, you're identifying what you were seeing as questions in your head. Hang on a sec, I'm really good at my hands-on work on this person, but they're not getting better. And you said about tightness and locking up and the body turning on that protective mechanism. I remember asking a couple of surgeons, friends of mine, do humans have a normal range of motion under anaesthetic? And they all said yes. Unless there's a bony block there, hang on a sec, the 70-year-old lady, her hamstring can go, her leg can go straight back to 90 degrees. So you've absolutely spoken about what they're seeing clinically. Moving on from there, you started to talk about Peter Taylor, and I'm assuming that's Professor Peter Taylor?
Yeah, Dr. Peter Taylor, he's clinical neurophysiologist. Yeah.
So clinical neurophysiologist. So
he does nerve conduction. So people who have nerves trapped in their spine, for example, called a radiculopathy, and are getting sensations, numbness, tingling, pins and needles, loss of sensation. Also testing and assessing people for nasty neurological disease like motor neurons disease, multiple sclerosis. He does nerve conduction, so he uses needle EMG. So painful needles and muscles, measuring how long the signal takes from the spinal cord for the nerve, for the signal to come all the way down the nerve.
And he's also a movement specialist, so he knows all the all the movement textbooks. This plus this should equal this movement, correct?
Yeah, absolutely.
So you talked about teaming up with Peter Taylor and researching at least 500 people with this EMG. Can you talk about what EMG is, and then why was he questioning what he had learned up to being a professor of movement and neurophysiology? What changed there?
So EMG, surface electromyography, or electromyography is the measure of muscle activity. So if I was to put a sensor, a surface EMG sensor on my trapezius, when I'm relaxed, the signal is very low. If I engage my trapezius, the harder I contract it, the bigger the signal is. It's measuring those motor units firing in the muscle from your brain. So the bigger the muscle activity, the harder your muscle's contracting, in its most simplest of terms. So what we were assessing with exercise using Peter Taylor's EMG, which could only measure 2 or 4 muscles at once,
right,
were exercises doing actually what we thought they were doing, or were people actually overloading their lumbar paraspinals when they were doing exercises for hamstrings, for example? So, we might look at lying hamstring curls, for example, as an exercise. And it's the classic one you'll see in the gym. You'll see lots of people as they flex their knees with the weight, lifting the bum in the air. So they're actually, yes, they're training their hamstrings, but they're also using their lumbar extensors and hip flexors to help flex their knees. So as a good example, we would get people to posteriorly tuck their pelvis with sensors on their hamstrings and lower back. And as a good example, people using much less weight, holding a posterior pelvic tilt with their glutes on, would get 50 to 70% more hamstring activation when they didn't engage their lumbar paraspinals or hip flexors.
So I could probably translate that into Damien language.
Yes.
So as a question to you, so what you're saying is doing a leg curl exercise, which is a gym exercise when you're working hamstring, yes. If they don't lift their bum up, if they actually keep their bum tucked, they get 50 to 70% more hamstring work than they did. How does that relate to a normal person, and I mean normal person being the 87% of people that don't go to gyms? What does that mean for them maybe in walking or going back to what you talked about, long-term chronic pain?
Well, what happens to the human body as we age, as our limbs atrophy, get weak, our arms and our legs, in my experience, we start levering off our spinal muscles.
Right.
Okay, so we start using the action of our lower back muscles. We start using lumbar extension, that action, to move our legs. We begin moving our arms. Instead of moving our arms from our delts, we start to move our arms from our traps. So in my observations, the general understanding of a lay person's anatomy and physiology is often very poor. They don't understand the actions of their muscles. They'll jump on an apparatus or do an exercise at the gym, and it becomes about shifting the weight, not actually, well, how am I shifting it? And what are the potential long-term effects? So if you're doing an exercise like lying leg curls, and you can actually only move 5 or 10 kilos truly with your hamstrings, but you're moving 50 kilos and you're using your lumbar extensors and hip flexors to move the other 40, well, what are you actually training? So your lumbar extensors and hip flexors get significantly more developed. Before you know it, you're walking with an anteriorly tilted pelvis, or really engaging your lumbar extensors to walk. You end up with an overloaded, compressed spine, and you start getting joint pain, or muscle attachment pain, or hyperactive spinal muscles, which I'll go on to later.
So you really, again, summing that up or unpacking what you're talking about there, you're kind of saying if they haven't got a bum that works and hamstrings that work and shoulders that work, they're going to get their lower back or their neck, which, hello, neck and back pain, absolutely increased just by walking.
Absolutely.
Daily activity.
It gets magnified.
Wow.
Absolutely. So if people don't have a good understanding about their physiology and anatomy and understand the actions of their muscles, you know, they'll go do exercise and they just won't naturally do it right. Just because we're human beings doesn't mean our muscle patterns are ideal. Some people are very lucky genetically and just naturally move very, very well. But things that influence our muscle patterns are sports we played, you know, such as swimming or tennis, or did we play cricket, being from New Zealand and Australia? Did we grow up in a house with stairs? You know, lots of things impact our muscle patterns and how we naturally move, including, you know, our genetics and mum and dad. And so there's lots and lots of factors that influence that. So it's, I think, one of the main prevalent factors contributing to back pain and neck pain and musculo-skeletal pain worldwide is that very few people naturally move really, really well. The rest of us need a bit of coaching.
Now, you've nailed where I'm going next. Bit of coaching. That had a glimmer of hope there for us. Because you started talking about most people don't understand the physiology. That's a big word. And you've just proven it was wrong. Anatomy and physiology function, the function of the way we thought we moved in the textbooks was incorrect. So what do you do? What does body synergy do that can help someone with that they don't have to go to university and get on a clinical trial? How can you help them?
So we're going back a step to doing video analysis. I did those 5 years of video analysis. I realized the limitations on it. At the time, I didn't realize people could actually use their wrong muscles to stand up straight. So they could fool my analysis. They could look like they had a really good pre versus post transition, but they were still in pain. Why? So then I was lucky, EMG, the cost of surface EMG had dropped, you know, half price. Brought my first EMG, instead of being able to measure 2 or 4 muscles at once, we could measure 16. Complete life changing. At that time, I'd written a book, had it at a publisher, getting ready to roll, and I realized at least 50% of what I thought was right wasn't right. So I put the brakes on that, and I spent the next 18 months assessing over 1,000 people, muscle patterns, walking, standing, walking, running, using EMG, being able to measure 16 muscles at once. And what I found out is 50 to 60% of what we had done was absolutely on the right path, but some things, some ideas in our approach needed changed. And also we discovered that certain spinal muscles, such as upper trapezius and lumbar paraspinals, can become hyperactive. I never knew that. So what hyperactive muscles mean is that muscle's contracting on its own with a significant output and you don't feel it anymore. So it's just contracting hard. And that causes a problem. So for normal muscle function, muscles need to contract and relax to allow deoxygenated blood to get flushed out of the muscle and oxygenated blood to come in. So if a muscle's contracting continuously all the time, it's not good. Blood gets stuck in the muscle, easy to feel in upper trapezius, the big knots you feel. If you're feeling big knots in upper trapezius, it's pretty much edema, deoxygenated blood that's got stuck in the muscle, usually because the muscle's hyperactive. So going back to your question, after all these years of doing EMG, now I've gone the other way. I only use 2 or 4 sensors. That's all we need. It's completely wireless. So I can put sensors on a person's body after a musculoskeletal assessment, and I will look at their muscle patterns. So I'm measuring really their knowledge. What's their understanding of their anatomy? Do they know how to move properly? So because I was aware that when people don't have good awareness or our limbs atrophy, such as our leg muscle strength and arm muscle strength, spinal muscles become hyperactive. So I've learned how to shortcut and fast track. It's one of the first things I'll check because it tells me so much about an individual. Have they got hyperactive muscles or have they not? Some people do, some people don't. And some people can have hyperactive spinal muscles for years and no pain. They're lucky enough to have nice, juicy cartilages that can handle the compression and load. Everybody's different. The human body's incredibly complex. It's never a one fits all. But so what we do is we use EMG as a coaching tool. We use live time EMG muscle feedback while people are hooked up to teach them how to move. So they learn to move to sphere their spine. That's pretty much sums it up. So we will use it with a variety of exercises, isometric exercise routines. We start with, but we'll teach people how to sit at a desk, hold a phone, wash their hair, brush their teeth, drink a coffee, move, walk, everything we do in daily life. They're set up in a vehicle. Lots of things can contribute to musculo-skeletal pain. And if someone is doing an activity, either at the gym or in their everyday life, that's hurting them, as a hands-on therapist, you're trying to put a fire out with petrol. It ain't going to work, and it's a classic client feedback where I felt great for 24 hours, my pain came back, or it lasted a week, and that's all I got. And they look at you like, treat me harder, do this, do that. If they're doing an activity which is overloading their tissues, all the hands-on in the world ain't going to fix it. And if their muscles present as hyperactive, if they got hyperactive spinal muscles on EMG, upper trapezius or lower back, all the hands-on manipulation, massage in the world ain't going to change it. In my observations, I've tried. You name it, I've tried. I've had fellow colleagues work with me trying. What changes it is education. Teach them how to move differently.
I think it's amazing that you've said, you're putting the sensors on their body, and then they've got the real-time feedback in a screen in front of them, and they're drinking a cup of coffee or on the phone. I remember being in your clinic and watching one of your clients, and you developed some exercises. I think there was a cable machine and so on, and they're doing the exercises perfectly. This guy had migraines, and his neck, his upper trapezius muscles were really overworked. And he was doing the exercise perfect, and as soon as he got off the machine, ping, they were off the chart. So his exercise was actually walk around the gym for a minute between each exercise, and that was his retraining. And that really brought it home to me, Rowan. It was, you're doing those things that are so far outside the gym that will prevent their pain from coming back.
Yeah, well, there's been such an assumption for years that muscle patterns can be changed through exercise. So yes and no. Perhaps you can around the lower back if you do lying leg curls, levering with your bum in the air, levering off your lumbar extensors and hip flexors, and do it enough. That could have a detrimental impact and probably be measurable. Another one is if you say like me from Scottish ancestry, hip dysplasia is common there, shallow hip capsules, long femurs, we ain't designed to squat. We'll do our best to squat, but our torso is going to be thrown forward, and there's nothing we can do about that. But before I knew that, I tried to squat as hard as I could for 10 years, and just my anatomy wasn't going to allow me. So I was training my lumbar extensors way harder than my quads. So I ended up with huge lumbar paraspinals after 10 years and still had skinny legs. But anyway, that's an example of that creating a detrimental muscle pattern. So where your paraspinals are so engaged, become hyperactive, they're working all the time, and inevitably you end up using it more in your glutes, so you're actually extending your leg from your lumbar paraspinals more than your glutes. So that's an example of exercise impacting, but I think it's been over-exaggerated what we could actually do with corrective exercise. If someone has hyperactive spinal muscles, you can't even walk and control them. Exercise ain't going to make that change. As you alluded to, that gentleman was doing, close grip pull downs, engaging his lats. His upper trapezius was calm, perfect during the exercise. But as soon as he stopped and got up more, he'd go berserk. All the pull downs in the world weren't going to make any difference.
No.
Him watching the real-time EMG feedback, holding his shoulders down and learning to walk and engage his, chest, pectoral muscles and lats, just a little bit, enough to calm down the hyperactivity of his traps, that was going to make the difference, not exercise,
And if I give a personal example, people that are listening here or watching us, we're talking about neck and back pain specifically, but it does push up to other muscle groups as well. But, being a soldier, in particular a special forces guy, we wear body armor. We hang weapons off our arms. So our muscles, our trapezius muscles are overactive all the time. And, I went to see you, I spent a considerable amount of money and time with you in Dunedin to fix these things. And I was Mr. Perfect in the gym, going great, got the sensors on, but, I was lucky enough to take them home to your place, and I was just cooking dinner for everyone, and boom, off the charts. And that example brought home to me, you need to train this, not for very long, but train it in all your environments. So hearing you speak about teaching people all these natural movements in the gym, on the phone, putting seatbelts on, all these things, that's phenomenal, because that's where people really get pain, Jock. I'm sure in bed, getting out of bed, activities with your sexual partner, all these things, they're real movements. We're talking about real stuff. Not just
everyday movements count. Everyday movements count. You've got to sort the everyday stuff. Otherwise, someone can go to the gym and do 3 or 6 months rehab and increase their tissue loading so they get a reduction in pain. But within 2 weeks to 6 weeks of stopping exercise, their pain will come running back, because these underlying hyperactivity issues or poor movement issues are still there. So that's why we, really change those everyday things and change them for good, because once people have learned them, they don't want to unlearn them, because it's made such a phenomenal difference. And also, not everyone likes to exercise and work out like we do, and a lot of your listeners stay in. So, a majority of people loathe exercise. They'll do enough to get better, and I don't want people to depend on me. So I want to educate them with knowledge. If they come and do 3 months rehab, beautiful. I want them to get 3 or 4 years relief out of it. They're going to learn to move differently, do everything from computer work to drive to clean their teeth differently. And so they can come back and do another 3 month rehab in 3 or 4 years and get a top up. But, education is everything, absolutely everything, and making a difference.
So what about mindset, Rowan? Mindset for those optimal results?
Mindset for optimal results. So when people come to our place for rehab, I'll assess them, and I'm a very straight shooter, Damien. As you know, I do not muck around. If someone needs 6 months rehab, they need 6 months rehab. If they need 3 months, we can sort them in 3. I'll tell them we can sort them in 3. But it's understanding and getting across what they need to do. And I actually make my clients sign it off. If I need them to come 3 times a week or 4 times a week, or in some cases 5, they've got to sign a gentleman's agreement with me that that's what they're going to do. Because if someone comes 3 times a week for 13 weeks, in our environment, it gives us 39 sessions to coach them. So if they need lifelong habits, and we're trying to put them in physically stressful situations as their pain reduces, we're trying to expose their habits of movement. What do they do? What do they do under stress? We need to be able to find that, fix that, change that, so they have a long-term change, and help them understand. Don't just do exercise and do the correct rehab for 3 or 4 weeks, have a 70% reduction in pain, and then think you can sit on the couch, fold your arms and put your feet up. It needs that length of time. And that's why our minimum time period at the gym is 13 weeks. So 13 weeks for hyperactive trapezius, neck stuff, we can make a huge difference. But if someone's got quite a significant pelvic imbalance as well, it can take a lot longer. Just the structure's bigger, muscle groups are bigger. They take longer to control and longer to build up, you know, tissue loading where people can then do the everyday things and not get sore. But education and knowledge and transfer of knowledge takes time and it takes commitment. And if someone comes to see me and they can't commit to it, I just don't bother. No, because this is going to take. I mean,
you're just being. There's nothing negative. You're just being realistic.
No, realistic. There's no point someone coming in once or twice and thinking they can change 40 years of habits, because it's a lot to learn. And our clinic's set up to provide the safest environment where people can't hurt themselves, where we can load them up, where they can do a variety of exercises watching EMG and get that neurological change. As we know with training, the first change is neurological. And with VMG, real-time feedback, absolutely, that's the same. That's where the real nitty-gritty happens. The positive things happen right from the get-go. And creating that warm, welcoming, enjoyable, fun environment, the right social environment where people can come in because a lot of people who come to Body Synergy have never been to a gym before, you know? So they are nervous. They see people doing some amazing dynamic things, but when you introduce them to other members and they share their stories, those people they're watching, they came in broken once upon a time too. You know, and that's, people make some incredible transformations. And ideally, also if someone comes in and they've got a lot of wear and tear pathology in their spine, they're going to need to train forever. And I will tell them it's not a quick fix. Training is part of your life. Or if they're pre-surgery or post-surgery, and I see people who have had up to 4 or 5 back surgeries, they're training for the rest of their life. They don't have any choice. If they want to enjoy live time with their grandchildren or do the things with their partners that they love to do, it's exercise forever. It's no start and stop. So I'm pretty blunt. After 30 years of treating thousands and thousands of people and assessing thousands and thousands of people, I'm always incredibly respectful, but I don't beat around the bush. I tell people what they need and what they need to do.
But you've shown that integrity, Jock, and you know, I've got pages and pages of notes here that we'll be putting in the show notes. Integrity is what really stood out there. And for those of you that know the story of Professor Tim Noakes, you know, a doctor and a sports scientist, and he's the reason that everybody drinks Gatorade and Powerade and carbohydrate drinks. Well, after millions of dollars and tens of years of doing that, he realized that everything he was doing was incorrect based on the latest knowledge. And for him to come out and say that and not just take the money as integrity, you stated, you know, 50-60% of what he wrote in that book is right, but hang on, it's at the publishers, stop the presses.
Absolutely. Totally.
It's integrity, mate. It really is. And people appreciate that at all times. But you touched on something else there. We talked about social in the clinic, in the gym, and I say gym in air quotes. You know, we've come a long way. I'm sure that you and I years ago would just think lift weights and eat food and get a rub every now and then and you're fine. Hang on a sec, you talked about social. We know now that's a huge component, you know, eating, movement, stress, sleep, and social is so important for wellness.
Yeah, I mean, we've learned a lot together over the years, but the most important thing, we've always been open to learn. You're always doing the best you can. As a practitioner, when I was massaging people, I was always massaging people with the utmost integrity, doing the best I could with the knowledge that I have. So when you start making observations that, hey, sometimes it's not ideal to treat, you find out why, and you first to put your hand up and go, made a mistake here, I now know for the future. And we've always asked ourselves those questions. I think it's really, really important to always stand back and observe. And look, when I first created Body Synergy 15 years ago, I had no understanding of the importance of the positive atmosphere and also the social environment and people teaming up together and getting better together. And look, for all I know, that could be the biggest secret of body synergy is the environment. My business partner, Ricky, who's amazing at making people feel 1,000% when they walk in the door every single time. That could be it's the whole combination of factors together. As what I've learned over my years, human beings, we're very complex creatures. And one of my favorite sayings is always seeking first to understand, then to be understood, and to give people the time they need, the environment they need where they can come in, feel comfortable, and start getting better. You've got to give them a reason. Like I said before, a lot of people don't like exercise. Give them a reason to like it. And if you can keep them at it for long enough, the quality of life improves, and then everything changes. Everything's easier. So all those factors together are extremely important.
Yeah, wow, what a great quote. Seeking first to understand and then being understood. We've talked a lot about chronic long-term pain, exercise, rehab, and you talk about being blunt and a gentleman's agreement, a whole bunch of different things there. And really, if you're understanding their pain, the avoidance of pain is the best motivator of man in reality, unless you're really out there, pain. But, you're talking about seeking first to understand their pain, and then you're going to then teach them this is what you need, so they're going to understand that. I thought that was a great way of putting it.
Well, people need just one thing, Damien. People need an environment of organisation. So another observation I've made is some people end up with musculo-skeletal pain because they're just in a bit of disarray. Right. You'll hear Dr. Libby talk about rushing woman syndrome. I mean, I've seen that in the gym. I believe it's real. I've had clients race in, race out. Their upper trapezius is incredibly hyperactive. They've got a gazillion things going on, and we're trying to calm them down, and it's the rushing round that's hurting them. No one's been able to sort them out and help them, other practitioners they've seen, because they just won't slow down. That's real. Get them to slow down and everything gets better. So it's just making all those observations of, taking all those factors in is, and also if someone consults you and they explain their history and they haven't got better and they've seen some talented practitioners, well, are they just not good listeners? It's also something else to consider. So really, the social aspect, really understanding and listening to people. How do they tick? Are they clinical? Do they have a clinical approach to life? Are they to life? Are they mosaic and a bit all over the place? What's going on? Because that has a huge impact on how they're going to respond to an environment we put them in for exercise. We've got to sort of tailor it to fit into how their life works and how they tick. And that's another part of getting the social aspect exactly right.
You're so right. It has to be applicable to the person. So you're not putting a template to them. We'll try and tie this exercise, rehab, chronic pain thing in a bow, and then we can move on possibly to performance. But what a great thing you put there. Did you call it rushing woman syndrome?
Yeah.
I like to call it mum and dad brain. I've literally walked around in circles once, and after I did, I went, what did I do that for? So can you paint a picture, if we can paint a picture of what someone will experience coming into the clinic? Because I know it, and I can know that I'll be super busy, but I see the screen in front of me, I can do the exercise. Just paint a broad brush picture of what someone actually goes through in the clinic in an exercise session.
So if someone has pain, they'll come and have a consultation with me first, which goes for an hour. I will sit down and listen to their history and listen very intensely, because that's where a lot of my answers are found. I want to know who they've seen, practitioner-wise, who's treated them, if they had hands-on, how long of relief did it give them, what's their sporting history. Then I will do a musculo-skeletal assessment. So I'll test all of their joint ranges of movement. What I'm looking for is any real red flags. Are they hypermobile? That is, they lie on their back on supine and lift their leg up and down. Now the sacroiliac joint's going clank, clank, clank. Have they got an arthritic hip or knee that has been missed? Often these things get missed. I'll do various nerve tests, testing sciatic nerve flexibility, reflexes, femoral nerve flexibility. Then I'll start testing muscle imbalances. looking for muscle imbalances, then I will test them on EMG. So I will hook their spinal muscles up, I'll hook any muscles up in their body, superficial muscles up in their body, looking for what is going on and why they haven't gotten better. So from that then, I can tell, can I sort them out straight away with hands-on treatment? Are they going to need just some simple exercises for home, or do they need a stint in the gym? From then, if they need a stint in the gym or whatever for home, that's why I make the videos, they can do it at home if need be. But if they present with very hyperactive muscles, or their limbs have really atrophied and they need some serious coaching, we're going to get them into the gym, book them in, and they will come in and start. And we'll get them into a very structured routine. They will have signed off with me how many times they're going to come in. We make it as easy as possible. We try and take all the hurdles away for them. So, but we get them into a routine. One of my favorite sayings is, without a plan, you're planning to fail. Or the person who aims at nothing always hits their target. So I try and understand how they work as a person, and we implement a plan. So we're waiting for them to turn up every appointment. They'll get surface EMG each gym session as long as they need it to learn to control their muscle hyperactivity. It's an amazing coaching tool. They may have 5 EMG sessions. They may have 25. They will get what they need. The goal, of course, is if they're coming for 3 months or 6 months, by the end of their term, they don't need us. They can do all normal everyday activities. They can do every gym exercise, every core floor exercise perfect, because then they don't need us. If we can't teach them that, we failed. So that's always our objective. And look, 70% of people want to stay on because their life is so much better, and they can move into workouts of the day and the whole social aspect. They've made new friends and they've got workout partners, and life's so much better. And look, we are all better if we train. But those who don't, we'll set them up with a plan for home, and they can do my YouTube videos and follow them at home and keep it up. And those who need hands-on treatment, yes, a lot of people still need to see me once every couple of months or once every 3 months for a treatment, because they're born with genetically tough connective tissue that just binds up even with the right training. And they've got so much wear and tear, they just need loosened up. You know, corrective exercise will help to a point, but if people have had a lot of impact injuries or are born with, like I said earlier, really stiff connective tissue, it's gonna bind up. We're not designed to live forever. And if people need a treatment once every 3 months to complement their exercises, well, that's fine, that's great. It keeps them moving and mobile. So we implement that plan as well, just so people have complete care. There you go, that sums up body synergy.
Awesome. We'll talk about at the end, which we're coming up to soon, about where we can find you and so on. But let's finish up on the below par side of things. Let's talk about performance, because I know, I mean, I've got the inside knowledge with you. What about doing all this amazing research and putting it towards improving performance? And improving performance is getting from injury back to normal, which is great. What about taking that step above? Athletes, people that are listening to this, maybe thinking, okay, it's not really for me because I'm not injured, or once the injury is fine, I can deal with that. What about improving performance with your skills, all the knowledge that you're applying there?
Well, in my observations, like if you get a team of rugby players, you can't train them all the same. You know, you can't, well, here's a program, guys, we're going to go through and do all this strength training in this phase. You've got to take into consideration mobility. Where are they from? Do they have nice deep hip capsules at the right angles that are perfect for Olympic lifts? If they don't, you know, they need to train other ways. You know, I would test them all on EMG. What are the ultimate exercises for, you know, muscle output, you know, for all muscle groups, and then tie that in together. I think some athletes, like you could train get a team of cricketers to squat a 30, 5 guys get injured all the time. Why do they always get injured? And everyone's doing the same training. It's because the trainer's training's hurting them. It's not it's not complementing their natural, their hip joint structure or their, length of bone. Or we're so complex. And I think it's something that's really missing. If trainers learned just general range of movement tests, some simple surface EMG, it could really influence some subtle changes to training, but it would make them more athletic, less injuries. So the benefits are a high-level athlete with great genetics gets less injuries in his career. He's going to have more time at the top. And I think that's really where there's a big consideration needs to be taken where athletes get injured training. You've got to take each person on their individual merits, their biomechanics, their anatomy, their bone structure, and just modify things slightly. And I think you get much better results. As I've seen with individual athletes I've worked with over the years, you get a longer career. And hey, look, if you're earning $1 million a year and you can do what you love as an athlete for another 7 years, it's pretty handy at top level.
Oh, absolutely. Absolutely. I love how you've, all the top people in the world, and you are definitely one of them. That's why I've got you there. Dr. Stuart McGill or Professor Stuart McGill, they all talk about longevity, not getting injured. I mean, just stepping back here, it doesn't make sense to be injured during training for your sport. That just doesn't compute.
No.
We saw the basketballer the other day, his Nike shoe. I don't know if you saw the YouTube video. It went viral. The sole ripped off, and he's got a horrible knee injury from that. That's during sport. That's a trauma injury. Sure.
Absolutely.
An All Black knocks over a wallaby, and the wallaby gets injured. That's to be expected. But you shouldn't be getting injured doing squats in the gym, training for your job.
Yeah, well, absolutely. If you're training and you're just, out of the training and you're being a hammy, so you've always got to ask the question, why? Why did that happen? Was it just straight tissue overload, or is something contributing to it? So that's been realized, the introduction of Nordic hamstrings, brilliant. There's some clever people out the world who are doing some wonderful things, which we all get to share and enjoy with this technology. It's great. But Nordic hamstrings are great, and the Copenhagen adductor exercises, understanding the eccentric loading of muscles really does strengthen connective tissue. Nordic exercises, for example, for hamstrings cause sarcomeroneogenesis and make hamstrings grow longer and stronger. Beautiful, brilliant, less injuries. So things are always evolving, but we've got to really look at it as professionals and practitioners and trainers. What we're doing truly benefiting our athletes or our clients, or is it not? You've got to make observations over a long time. So that's why I used video analysis for 5 years before I went, nah, I'm missing something. And now we've done EMG for over 10 years. And the last 3 years, Damien, I haven't come up with anything else that's been exceptional. We've really figured so much out. We haven't really changed anything for a long time. We're adding bits and pieces in from other innovative people from around the world, which is really, really cool. But it takes time. You've got to observe things over time and have a wide angle view. Look at your athletes, if you're training athletes, and go, really consider, is what I'm doing, is it fit for everyone, or do I need to learn some musculo-skeletal tests and assessments to load up the tools in my toolbox that means I can really complement an athlete and make them even better? And heaven forbid, some athlete might get way more benefit out of leg press than squatting. It's not a one-fits-all,
Yeah, you nailed it again, Jock. It's nice to see that the top people in the world, and there's not many of them, really seem to have come to the consensus, and a lot of people don't know each other, of what's working, but it's just not mainstream at all. I think we've pretty much touched on all the points I wanted to go through. You did mention YouTube and videos, and you can do the video exercises at home. Ultimately, we talked about a bunch of different things. So where can we find you to get some treatment for you or your colleagues? Where can we find the clinic, the Body Synergy Gym?
Sure.
And for everybody else in the world that's not in our gorgeous country, where can they resource online some things that will help them?
Sure. Thanks, Damien. I reside in Dunedin, which is New Zealand, the lower part of New Zealand. You can find me at our clinic called Body Synergy. You can find us on the website, bodysynergygym.co.nz. I have 30 different YouTube videos available, which incorporate isometric exercises, routines that I've created to calm down hyperactive spinal muscles and improve muscular awareness. In our clinic, they're incredibly effective. You don't need any apparatus. And the risk of harm is incredibly low because you're only using your own muscle contractions to exercise. You're using no weight, no resistance. You're just squeezing your muscles. And it took me a long time. It took me 25 years to work out that was the best thing to do. And isometric exercises, also important to touch on, they have like an anesthetic or analgesia effect. They help reduce pain, and some research to show that. So they're great for people to start with. But you can find them on YouTube. You can find videos there on how to set up bikes, spin videos. We use a lot of cycling for rehab with specific techniques. It teaches people how to load up their legs and lats and core without levering off their lower back. So we use a lot of cycling videos. There's core videos there with subtle changes of technique and posterior pelvic tilting, how to do a variety of routines. So, and they're made mostly for people overseas and people at home, so they can follow a structure through of rehabilitation. I've even got, I think it's 5 or 6 playlists there, 6 weeks of rehab. People can work through if you don't live in New Zealand and still want access to a structure of what I've created and followed. There is nothing like coming to see me for a consultation. There's nothing like getting a proper assessment. There's nothing like being assessed with surface EMG. And like you've done several times, Damien, it's even worth coming to if you live in Australia or overseas. Come to New Zealand for a week. You can spend a week at our clinic and really, really get 3 months of learning if you lived here compact into a week, and lots of time on EMG. And that's where the rubber really hits the road if you've got pain, so to speak.
Yeah, it really changed everything for me there. Spending that time and that money coming over and getting that concentrated relearning of what I was supposed to have been doing right and I wasn't. You know, those YouTube videos, you got a phenomenal, Rowan, and I use them to keep muscle on when I'm not, can't access weights as well. That's awesome. I'll put these things in the show notes there, and definitely the videos and that playlist of those exercises. Really, really cool. I just want to thank you for your time. It's been amazing. I learned a whole bunch of stuff there. I always learn on these things. It's great. And yeah, from my end, for those people listening, if you got the chance to go and see Rowan, definitely get over it and do it. And if at the very least, just look at some of those videos and do those exercises. They are amazing. And the results I've seen from myself and clients and Rowan's clients have been absolutely awesome. And yeah, look at Body Synergy Gym. They've got a great product there that I think is not only world class, but is very unique. I haven't seen it in any other place. So congratulations to you, Jock, on your...
Thank you, Damien.
On your experience and helping others. It's just great. I mean, the passions come through. That's what you want to do, and your integrity and your education and helping other people get better. So it's been great having you on.
Thank you very much for having me. It's a pleasure.
Awesome. Thanks, John.